Okay, so welcome to tonight's workshop. Dr. Maya Ziegler of Monarch Family Chiropractic, and we are talking about headaches and migraines and why they matter. And tonight we're going to get into the different types of headaches that we can experience and what we're seeing in terms of the long-term impacts if you are someone who experiences migraines, what we're seeing down the road if it's not addressed. And then talking about some solutions, but we really want to dive into how our spine impacts us as well. So like I always say, I really appreciate those of you who stop what you're doing at a 5:45 or a 5:50 on a Tuesday night to be with us for a half an hour to really learn more about health and health related things, because a lot of people aren't doing those things. And I think it's really honorable because it holds you accountable to doing what's most right for your health. So let's talk about headaches. Now, headaches, this is according to the National Institutes of Neurological Disorders and Stroke at NIH. Headaches are considered the most common form of pain, and it's a major reason that's cited for days missed at work or school, as well as the most common reason to visit the doctor. And one term that I find fascinating is the term chronic. And a lot of people think that in order to have a chronic condition, it needs to be around for a long time. But what we're seeing with chronic is that it is around for 3 months or longer. So if you have something that's lasting for 3 months, it is considered chronic in terms of our traditional healthcare system. A lot of us want to normalize what we're experiencing, or it's something that's, always there, or it's not so bad, but it is not normal to experience pain. It's common. Likewise, it's common to see something more chronic in our population. A lot of times when we're doing an intake, how long has it been around? It's pretty common to see it's been around for years at a time, months at a time. So I want you to think about a headache as an energy crisis to the brain, whether it's a neurological crisis to the brain, like the brain isn't getting appropriate nerve function to the brain, or it's not getting appropriate vascular or blood flow to the brain. So I want you to think about it as a crisis within the brain, and it is a stressed brain, okay? And if your brain cells are in an energy crisis, it can lead to degenerative stress to the brain, okay? And we're going to get into what exactly that degenerative stress means. But there's two types of headaches that I usually like to go over: intracranial and extracranial. Intra meaning it's coming from the inside. This typically is a migraine, or a migraine falls into this category. And a migraine oftentimes impacts, it's one side of the head, can be coupled with vision changes or an aura or light. And there can be an increased sensitivity to sound. If there are physical changes within our structure, sometimes those physical changes can come from your brainstem due to past injury or past illness. So a lot of times if somebody has had any type of concussion or whiplash, that can impact the brainstem. Sometimes these can come from our eyes and how our eyes track, how our eyes move. And so we see with light or a lot of screen time, our eyes are impacted. Eyes are a window into the brain. So if we're getting a lot of light exposure or synthetic light exposure, or a lot of tracking of small things on a screen, that can cause or trigger a migraine or an intracranial headache. Poor posture can be a physical component that can contribute to an intracranial headache. And we'll look at that in just a moment. And then other health conditions that are related to your head and your neck, including your TMJ, so your temporal mandibular joint. And everyone has TMJ. So it's referring to your joint. It's just if you have dysfunction with your TMJ, or restriction or injury to your TMJ, that's when you get into problems that could contribute to headaches. But some people say, oh, I have TMJ. Well, we all have TMJ. It's just you maybe have some specific concerns around that joint. A lot of times when Doc and I are adjusting, we're going to the upper cervical spine, And we're going to the jaw. We're also going to the bones in your head or your cranial bones, because all of that can impact nerve function and vascular function. And then if you have high levels of inflammation, which can affect the nerves in the brain and the blood vessels. And when we're talking about high levels of inflammation, that can come from a physical injury. Can also come from more of a chemical component of foods that we're eating, or if we're exposed to a lot of chemical stress, our ability to respond and adapt to increased exposure is less. And so we have an outcome like an intracranial headache or migraine. Now, I found this to be concerning. This came out of Harvard Health Publishing, or the Harvard Medical School. Migraines. Can dementia, stroke, or heart attack be next? Because they're seeing long-term effects of a migraine can permanently change your brain structure. So after increased blood pressure, migraine with aura was the second strongest single contributing factor to risk of heart attacks and strokes. That's concerning, because I think a lot of people normalize a headache or a migraine. They say, oh, they're just migraines. But these are symptoms of, again, a stressed brain, a brain that is potentially degenerating over time. And second to high blood pressure is a migraine that can increase your risk for heart attacks and strokes. So in this study, the results showed that migraines with auras increased the risk of white matter brain lesions by 68%, and migraines with no auras increased the risk by 34% compared to those without migraines. And the risk for infarct-like abnormalities, which is a stroke, increased by 44% for those with migraines with aura compared to those without. And so again, this is an energy crisis to the brain. It should be taken into a serious consideration, because we're always looking at what's the trajectory that a person's health is on. What does it look like 10, 20, 30 years down the road? Heart disease does not happen overnight. You know, the potential for a stroke, conditions for a stroke, you know, to happen does not occur overnight. It happens over years and decades. And so when you have these components in your health history, they need to be taken seriously. And you want to get to the root cause of it. Let's look at another one. So this came out of the Multiple Sclerosis Journal, and it involves 68,000 women in this nurses' health study, and they found that women who had a history of migraines was associated with increased risk of multiple sclerosis. So again, scary when we're talking about strokes, heart attacks, multiple sclerosis. Multiple sclerosis, I have a very personal experience with multiple sclerosis because I was diagnosed with it about 8 years back. And it is where you find lesions in the brain or the brainstem. Lesions are just spaces in the brain that don't match up with other parts of the brain. Okay, so it could be plaquing, it could be deadened tissue or deposits. They don't really understand. But this study is just showing us that if you have a symptom like a migraine and a history of that, it leaves you predisposed to these diagnoses later on in life. Okay. So let's talk about the importance of the neck and the cervical spine. And I'm going to read straight from this. Your cervical curve, which is your neck, benefits you. So if you have restrictions in your cerebral blood flow, so your blood flowing to the brain or the blood flow within the brain, if you have restrictions there from vessel narrowing, called stenosis, clot formation, which is called thrombosis, or blockage, which is an embolism, or blood vessel rupture, which is a hemorrhage. Okay, sorry, I was like, where's that sentence going? I got distracted by all those big words. So if you have restriction from those four types of components, then certainly it could impact energy, an energy crisis to the brain. But lack of sufficient blood flow affects brain tissue and may cause stroke. And when we see correction of a cervical lordosis, it's associated with an immediate increase in your cerebral blood flow. So these are not directly related, these two research papers. But what we're saying is that we've seen that when you have a healthy cervical curve or a neck curve, we see immediate change in your blood flow. And so if we improve the health of a cervical spine, it may in fact change the cerebral blood flow that's occurring to the brain or within the brain. And let's continue here. So I want to talk about extracranial headaches. Okay, so what is the outward impacts of our environment and our bodies that are creating some stress and tension to our brains? So extracranial typically is more tension-like. So it's dull, aching head. Sometimes it could be a head strap. So it wraps around, pressure and tightness across the forehead. I could have muscle aches and pains. Could be sensitivity to loud noises, could be tenderness. And these are typically more episodic in nature. They happen in episodes that occur, in frequency, in terms of days and last 30 minutes to a few hours, or they could be more chronic where they last several hours, are more continuous. So it could be termed I guess falling in two different categories in terms of these types of headaches. But again, the physical component, what contributes to an extracranial headache, you'll see a lot of these are similar as the intracranial. So here we have TMJ. So if there's any issues with your TMJ, bruxism is grinding your teeth at night, or clenching your jaw when you're asleep, or sleep apnea. If we have prolonged sitting, or we have lack of movement, we have distortions in our posture. If there's too little sleep, women tend to be predisposed to these types of headaches compared to men. And if you're middle-aged, you tend to be more predisposed to it. So it says, while anyone can suffer from headaches, there's evidence that tension headaches seem to peak when people are in their 30s or 40s, possibly due to growing stress levels and less physical activity. So again, especially when we're looking at extracranial type headaches and tension headaches, there's certainly a correlation with physically how we're carrying ourselves. And we look at that cervical spine. So let's look at some pictures here. So I want you to think about an unhealthy structure is an unhealthy brain. And think about headache as an energy crisis to the brain, whether it's neurological or vasculature. So I just want you to see these side by side. So these are actually the posture pictures and their x-rays. And posturally, we see people all day long. And unfortunately, we're seeing people with this, it's called anterior head carriage, but forward head shift here. Their ear should be right above their shoulder. So we're seeing this forward head carriage with a lot of people. And the more forward this head goes, the more stress on all of this stuff. So no wonder we start to see tension and rigidity and achiness, because this musculature is constantly, chronically stressed. This is shortened here. This is lengthened here. And this is doing a real good job trying to anchor and bring that head back. But you've got a spine that literally has shifted forward. So those tissues are always going to be under stress, because the tissue always goes with this where the structure is. So until you address that forward head carriage and that structure, you can work on the soft tissue all day long, but it's only going to go where that structure is. And this is why people who go to massage therapists and get body work say, oh, this is just really provides minimal or temporary relief, because you're working on the musculature and the soft tissue to take the tension and the rigidity out. But that's there for a reason, because your head is so far forward of your shoulders. They say for every 10 inches forward, you can add 10 more pounds of weight to your head. But then we're not only going forward, we're going down. Okay, so for every degree down we are, I mean, at 60 degrees here, we're adding 60 pounds of pressure to our head. And we spend all day long sitting and on technology. And so again, you can see how somebody can start to show structural changes where they have this anterior head carriage that happens over time because, you know, we're starting very early in life being on our technology, right? So no wonder we see an energy crisis to these brains. Here's another person where we don't necessarily see that forward head carriage, but we actually see a reverse curve. So that curve that you see there, the back of the bones there, right here, that should line up with the back of this curve. Okay, so I'm going to just show you on, I'm going to annotate here. Let's do this one. So here's this curve right here, as I'm highlighting. The back of the spine right here should line up with this. So it should be like a banana. And the brainstem is just the brainstem is here. The brainstem is just an extension of the brain, and then your spinal cord follows right along here. So if you've got a change like this happening with your structure, it's changing the tension on a cord. So this is certainly an energy crisis in terms of neurological function. And I mean, you got a lot of vascular structure that here. So, I mean, there's no question there's vascular impacts too. But you think about a banana, you straighten that banana, the fruit smashes. So you straighten this cord, excuse me, you straighten the curve and what's happening to the cord. And not only that, she's got a reversal here. So that's a big problem. That's not how that spine should go. So again, if you're doing a lot of things to help address your headaches and you've got this curve going on your structure, this is, I mean, the things that you're doing are going to be helpful, no question. If you're doing, trying to do some movements, take breaks from your desk, if you're trying to get improved posture and do some stress management type things, that is going to be beneficial. But if this is what's going on in your spine, it's never going to address, you know, the stress on your brain and your cord and your neck, right? Let's go here. Let me exit out of here. Here's, oh, I guess I do have to take that off. So here's another person. And I'm just showing you different spines because you just never really know what's going on. I mean, with that first person, we had major anterior or movement forward. The second person, we had some forward shift, but you had a reversal in their curve. This person, you're actually seeing some bony growth happening through the front of their spine. And when you see bony growth happening through the front of the spine, you have forward movement. Your body starts to build up that front of the spine to protect and stabilize. And when you have this fusion that's actually happening here, you can never get that back. So you can do a lot of work to do some curve correction, but to some degree, it's never going to go back to where it should be. So the goal is when you're having symptoms, they're just the way the body tells you there's anything going on. But they need to be used as a, you know, not to get rid of, but to say, okay, what is going on? Be curious and start to play with the things that you have in your toolbox to hopefully address the symptom. And by doing that, you address the function as well. Let me exit out of here. So as we go into that, I mean, what do most people do when they have a headache? What are they taught to do? Most people go to Tylenol or some over-the-counter medication to really address the outward symptom and get some relief. And while I'm not saying, you know, don't do that, if you're getting headaches, there's a reason you are getting them. So you really need to get to the underlying cause of those headaches. Typically, if it is a migraine type situation, there are, I think, really some top 5 that can be triggers. You know, like chocolate or things that you're eating or consuming can be triggers for a migraine. And it can be different for every person. I think chocolate tends to be a common one for some people, but it doesn't always and isn't always a trigger for that. So there can be a chemical component, can be an emotional component. We really focus on the physical component. So if you're just having headaches and you're just using your Tylenol or your ibuprofen or your over-the-counter medication or your prescription med because it's that bad, you're just really managing the pain. You're not addressing the deeper issue. And if you're not addressing the deeper issue, you look at, some of those people in the studies who have higher correlations of heart disease or stroke or MS, right? Your body continues to move on the trajectory it's on if it's not addressed in a healthy way. So what are things that you can do? Hydrate, electrolytes, making sure your body's absorbing the water. Minerals are important. Salts and the minerals that you get in electrolytes are really important. Improving your posture, improving your cervical spine and your curve, hugely important. Doing mobility movements and stretches. Prioritizing your workspace ergonomics, making sure you're standing and sitting and using your technology in a healthy way. Getting outside and getting some sunshine and fresh air. Sometimes a combination of those things can really change your experience. And if there's a big component that is stress that's contributing to your headaches, when you do these things, you're giving your body an outline to, step away from that stress, right? So there's the physical component of it, but also helping address your mental health in stepping away. So my hope with this workshop was really to just give you a different lens to consider why you're having headaches, and to really have a reality check if you've had headaches and it's been a part of your health history for a long time, needing to address it in a very different way. And we know it's the most common reason people seek out doctors. It's the most common form of pain. So the chances are that the people who are here tonight with us, some of us or all of us have had headaches at one point or the other. Again, it just is a big deal if it becomes a part of your health history and a normal part of your health history. It's not normal, but it feels normal when it's, something that you experience on a regular basis. And so that's where we ask that you share this information with the people that you love and know, because the likelihood that they've got something like this in their health history or know somebody is pretty high. And if we're just using pain management, like a Tylenol to really help address it, then we're just, it's just the tip of the iceberg. There needs to be much more to really address this in a bigger way. So that's where I'll stop. Know that when you are getting your chiropractic care, it's addressing both neurological function, but also vascular function, and improving how, just the energy input into the brain, improving how you engage in your world, improving how your spine moves, helping support better mobility and movement through your spine. When we get into curve correction, changing the tone on that cord and actually improving where you hold yourself. And we know posturally, if you maintain a healthy posture as you age, that person is a very different state of health compared to, people who have poor posture. So that's my ask. Share this with somebody that you know. And, if you want to dive into some, deeper conversations around this, if you feel like it's not being addressed based off of your care here, pull Dr. Kristen or I aside, and we want to make sure we do help support addressing it. But thanks for being here tonight, Dr. Mayakin at Monarch Family Chiropractic, and we'll see you guys next week for our next workshop. So take care.